Hello. So I have decided to go back to offering 3-day boot camps so that so many of you in the YouTube subscription community can plan to attend. So we have one this week coming up in May. We have another one in July. We promised to have another one in the fall. But right now, let me explain what is a boot camp. So many of you know about the pink packets, right? You know, for example, that I have pink packets that summarizes many features of the NGN test plan. Now, if you don't know what the NGN test plan is, that might be a little tricky. So let's remind you what the NGN test plan is, because that is exactly what will show up on your candidate report if, God forbid, or when you failed. Okay, so you remember that CPR report, candidate progress report? It is showing you the NGN test plan and how well you did in it. So if I'm going to do 3 days of NGN NCLEX, guess what? I'm going to cover the test plan. What's the test plan? Here we go. So the test plan, of course, is management of care. For the LPN, which of course we teach both, it's coordinated care. Well, what is it? It's that whole ethical, legal, workplace violence. You have your impaired nursing, your advanced directives, your consent forms, your DNR, your organ transplant, your consent form, all that stuff. That's management of care. Your delegation, prioritization, all of that is management of care. Well, in this 3-day boot camp, of course, we're covering that. Then, of course, we have our safety and infectious diseases. And here's where you better know your airborne contact, droplet, and standard precautions. You better understand some specifics about some infectious diseases, including measles, mumps, rubella, varicella, and your famous TB patient, right? So your hepatitis, your Lyme's disease, your bioterrorism, things like anthrax, those sorts of things are included in safety and infectious diseases. It's not enough to know that scarlet fever is droplet precautions. You must know that you need a mask within 3 feet away, that you diagnose it with the throat culture, and that it really is caused by strep throat, even though it's a skin rash. So we go over some of those things at the 3-day NGN NCLEX bootcamp. Health promotion and maintenance, that's a toughie. That is your maternity, your peds, your growth and development, your geriatrics, and even for health promotion and maintenance, it's your cancer screenings and the different levels of prevention as well as vaccines. Of course we're gonna cover that. Then you see psych. It's all by itself. They pull psych out and make it a lonely little subject all by itself, because guess what? It doesn't matter if you work in maternity, adult health, older adults, or tiny little ones. You're gonna deal with psych in every single one of those areas. So yeah, we're gonna talk about schizophrenic meds and antipsychotics and benzodiazepines and SSRIs and MAOIs and depression and bipolar and all that good stuff. That's what you're here for. You wanna learn your psych. Basic care and comfort, that is the one that you seem to understand the least, because essentially basic care and comfort is all the things that we do for the patient to make them comfortable and provide basic care. So if I just got out of surgery, basic care and comfort is cough and deep breathe and incentive spirometer. But on the other hand, if I have shingles, you better know cool compresses and loose clothing. See, it's so weird, but it's all the ADLs plus a little extra. Like I always tell you, if I tell you I'm constipated and you say, let me get you a stool softener, you failed basic care and comfort. Because what you should have said was, Shelly, you need to eat a high fiber diet, push those fluids, drink more, and maybe try walking after dinner, move more, okay? So yeah, we're covering basic care and comfort. Pharmacology, we all know that that girl, that nurse of 3 years killed a patient simply because she didn't know the generic name for Versed. Well, you'll never leave my class and not know the names of your drugs. That's retarded. And also some very specific information that is always a favorite on any exam you might take. we are going to look at the second most common area of failure with basic care and comfort. So people fail basic care and comfort as much as they fail reduction of risk, like for real. So reduction of risk is none other than basically your procedures, your IVs, your NGs, your Foleys, your everything. So your oscopies, your ostomies, your cold packs, your hot packs, your ear drops, your eye drops, everything. How do you position a patient for paracentesis? What's your focus after an amniocentesis? What are you doing after a thoracentesis? And what are all those central lines about anyway? And what about all those crazy positions? And how about that MRI or that CAT scan or that EEG and that EMG? You better know the differences and what they're used for. We are looking at physiological adaptation. Here we're going over signs and symptoms and who to prioritize, and we're looking at the labs of a patient and trying to determine what electrolytes mean for that patient. Physiologic adaptation is nothing more than pathophysiology. Why does something happen to a patient? And last but never least is the clinical judgment piece of the NGN NCLEX test plan. And so this is all of your case studies. And you know daggone well, you're not getting out of my 3-day boot camp course without doing some case studies. They're easy though, so don't focus on that. I tell you guys all the time, if it's anything you do well, for my years of looking at all of your reports, it's the case studies. Don't put much time into this. What I give you is enough. And no, this 3-day is not available virtually, but I promise to give you some good videos behind it, okay? Now, here are some key components of a case study. Recognize cues, analyze cues, prioritize hypothesis, generate solutions, take action, and evaluate the outcomes. That's all under the umbrella of clinical judgment. So our first day in boot camp, we're going to look at the Oh My God packet. Now, many of you already have the Oh My God packet, and if you don't, shame on you, because it's really, really cheap for now. So what I want to show you is that the Oh My God packet has everything I just talked about in the test plan as well. Watch this. The first part of the Oh My God packet is the study guide. How does Dr. Chelly's program really work? What is Chelly's Nursing Review, and how do they create the magic of such a high passage rate? Well, we go over for pages 1 through 5 the fact that you don't want to do too many questions at one time. You actually want to do a lot of miniature quizzes, right? Like 5 to 25 questions at a time, but a whole lot of those quizzes throughout the day. We talk about what score you need to say that you are ready for the test. We talk about what subjects you need to look at and which ones you absolutely have to know really well and in what order you should tackle them. On pages 6 through 8 of the Oh My God packet, we teach you how to prioritize and delegate. Those are covered very well. Even who should the float nurse get and who should you not delegate, right? So that's good stuff. On page 9 are all the labs and electrolytes and some tricks on how to really understand those labs and electrolytes in a simple, fun way called Miss Piggy. On pages 10 and 11, for page 10, we have system select alls that apply. So if you have a cardiac patient on your NGN NCLEX exam, I have everything you better include in terms of thinking about signs and symptoms for that patient. Maybe it's a respiratory, maybe your patient has a neuro problem. Well, those select alls on that page are so good for you to focus on with that type of patient. But then on the very next page, we have the precautions that go with some of those conditions. We have bleeding precautions select all. We have neutropenic precautions select all. We have ICP precautions, seizure precautions. We have everything you need. Suicide precautions as well. Dysphagia precautions also. On page 12, we covered the pediatric and maternity quickies. So think about what we just said. I want you to see what I just did. We said that prioritization and delegation would be covered on the Oh My God packet. That's management of care. We said that your labs will be covered. That's some of your case studies and recognizing and analyzing cues. We said some system select alls as well as precautions. That is physiologic adaptation as well as safety and infectious diseases, because infectious diseases are included on those pages. We also said we're going to talk about peds and maternity quickies. Well, there you go, health promotion and maintenance. Now, when we go a little bit further, you can see the diets and positions. That's your basic care and comfort. We cover that on page 13. And then you can see ethical, legal, cultures, religions. That's partly psych, and it's also management of care. Then, of course, the big bad bear wolf. It's the pharmacology, right? Pharmacology, oh my God. We do a lot with pharmacology. But just on page 16 of the Oh My God packet are these summaries of different drug categories. For example, you know that you have to know that antihypertensives can cause dizziness and you got to rise slowly. And you also know that your nitro can give you a bad headache. Well, you probably also remember that steroids increase your blood pressure, blood sugar, and make you retain salt and water. Well, all of those little summarizing points are on there, such as the fact that TB medications can decrease your vitamin B6 and cause neuropathy and should be taken on an empty stomach. I mean, I got you, like for real. And by the way, that's just one pink packet. That's just part of the 3 days. That's just part of 1 day of the 3 days. The next day, we do completely different stuff. The same day that we cover that Oh My God packet and make sure you know what these test plan features are, we talk about that reduction of a risk. You already know where we're going with this. You know, because I just said IV, NG, Foley, everything, and MRIs, CAT scans, EMGs, EEGs, colostomies, coloscopies, or is that a word? No, endoscopies. So I'm just telling you that this is going to be so much fun. And then, of course, you return after Friday. You come back on Saturday, and there we are with our infectious diseases and all the different precautions, and there we are tackling any and everything to do with pharmacology, you know it, and management of care. And then we finish up with EKGs and all kinds of fun stuff. So I am telling you, listen up closely. If you have not planned to attend a 3-day boot camp in Cleveland, Ohio, in person with yours truly, at which point you receive all 8 pink packets, including the Oh My God packet, as well as case studies at the time when you come, you are crazy, because this is the best ever bang for the buck. So you won't regret it. I hope this helps to explain what is boot camp anyway. Deuces, we love you. Have fun.